have to tell me later.
Welcome to Wellness Warriors, a podcast addressing the root causes of illness and their natural solutions. And now your hosts of Wellness Warriors, Dr. Justin Lane and Michele Schroeder.
Well, hello, Wellness Warriors.
Hello, Michael. How you doing?
I'm doing excellent. How about you, Dr. Lane?
Fantastic.
And you, Michele?
I'm excited to be here today.
I'm excited to be here today, too. We have a topic that we've never talked about before, which is why I'm excited to talk about this topic about acupuncture. So we're going to discuss how acupuncture helps to support the nervous system and your autoimmune system. But first, can I throw it over to Michele?
Absolutely.
Michele, I know that you are an expert coach. So from your perspective as a coach, how has your experience been with acupuncture?
Well, as a coach, the thing I hear the most is I am sleeping so much better. So when I have a client that's doing regular acupuncture, it does calm their nervous system and they get better sleep. But from my perspective as an acupuncture client, I also noticed a very calming effect, a lot of stress reduction when I would have an acupuncture appointment. And one time I got a frozen shoulder and I did acupuncture for 5 days in a row. And you have to understand that I had a frozen shoulder years before this, and it took well over 6 months to heal. And I had 4 months of physical therapy.
Wow.
And I couldn't exercise or move my arm for 4 months. Couldn't even put my clothes on. It hurt so bad. Well, the frozen shoulder came back, and I don't know why, but I got it, and I immediately jumped on the acupuncture train, if you want to put it that way. And I had Dr. Lane do the acupuncture 5 appointments in a row, and then waited a weekend and had a 6th one, along with some wonderful herbs that he gave me for pain and inflammation. And believe it or not, by the time I got to the next week on Monday, I could move my arm freely, and I was completely out of pain. It was kind of like a miracle.
Wow, that's amazing. So, Dr. Lane, I know that you are the acupuncture expert here with us today. Mm-hmm. Tell us a little bit about acupuncture, how it works, and what is this thing all about?
Yeah.
Do with that first, and then we'll get into some other stuff.
Yeah, so acupuncture is a therapy. It's like physical therapy. It's over 4,000 years old. That's with 3 zeros, 4,000, which is incredible that it's survived the test of time. Our MRIs are 50 years old, and our x-rays are 120 years old, just to give you perspective of how long this has been practiced. So it is a therapy. It's not a one-treatment wonder. Just like physical therapy, you go more than once. And what it's doing essentially is activating your pharmacy, which is your brain. Your brain has all the healing agents in the body, and the needles are really a vehicle to activate the pharmacy to release healing chemicals back into the bloodstream to facilitate healing. So it's doing a lot of things simultaneously. We talk about pain. It's increasing your brain's supply of endorphins, so it's creating painkillers for you, which are more powerful than the over-the-counter or the opiates. In fact, that's what the pharmaceuticals have been mimicking for the last 120 years, is what's in our body. But they can't mimic it exactly because you can't patent nature. So they come up with an artificial equivalent in the lab. But what we're doing in acupuncture, it's stimulating endorphin releases, which are your painkillers, and it's creating what are called prostaglandins, which are anti-inflammatories. So those things start to interrupt the pattern of pain that's been established, and it starts to break down that pattern and allow the body to heal. So that's one thing it does. And that's what we're probably known for most, is pain, headaches, chronic I don't feel good-itis, whether it's an ankle, a knee, a hip. It does other things too. I work with folks who have who feel depressed or feel anxious. So it changes your neurochemistry. It increases your serotonin. Your serotonin is your feel-good molecule. It's your enthusiasm molecule. It's your zest for life and well-being molecule. And it's very sensitive to things like blood sugar or your thyroid hormones. And so when we're doing acupuncture, we're creating serotonin. This is, by the way, what the antidepressant drugs are supposed to do, which is keep serotonin in your brain longer so you get the benefit of that. You get the mood lift from it. if you don't want to kill yourself or someone else first, which are the known side effects of these drugs.
Yeah.
So we're naturally producing serotonin and endorphins. And by the way, exercise also does this naturally. So we're lifting your mood, or we're reducing anxiety and depression during treatments. And we're also supporting your dopamine pathways. Dopamine's your drive and your motivation and your courage and your will to get stuff done. So those pathways get supported. That's a precursor to testosterone. It binds with testosterone in the body. So those are two things: pain, inflammation, and then we have mood and drive and energy. Acupuncture also regulates your stress hormone, which is called cortisol. So it modulates cortisol. Cortisol can be high, it can be low, it can be both. So it helps to just kind of self-correct it, if you will. So it helps reduce stress. It also regulates your white blood cells. So when we talk about the immune system, it supports the immune system by regulating the immune system. It increases blood flow in the body. All the healing agents in the body are in the blood. So when blood stops moving, we get inflammation and we get pain. We call that stagnation in Chinese medicine. So if someone comes in with shoulder pain or knee pain, they have lack of blood flow to those areas or a muscle. And what we're doing with acupuncture is we're forcing the brain to override and start to move blood to these areas again so it can start to heal over time. So,
Okay.
I would love to just ask something really quick.
Oh, go ahead.
So what I'm hearing you say, so like for those people who maybe are too chronically fatigued or too ill to exercise, acupuncture would be a really nice way to kind of get this on the ramp.
It can be a jump start to kind of release some of the energy in the body.
Yeah.
It also helps to produce it because it gets the blood moving and it activates your limbic system. Your limbic system is your sensory nervous system. So all the nerves that come out of the spine and are in our arms and our legs, it's activating those, and those synapse up to the brain and start to force the brain to release chemicals.
All right, so I've got some questions. So, and I'm sure this guy right here who's watching today's show has the same question. So I want to know, how does poking a little needle somewhere in my body do all of that? I mean, what does that thing do? Is it like a little radio antenna? Is it like, does it block something and free something else up?
No, it's a great question.
How does it work?
Yeah, so the needle itself is stainless steel. In fact, the history, it's interesting actually, the history of acupuncture. Before we had the Iron Age and before we had steel, we used bone. Actually, bone shaved down to a fine point was an acupuncture needle, and bamboo in traditional Southeast Asian cultures. So we have, those things were used through the clothing before we had the age of iron. And so now things have obviously, we have stainless steel, they're sterile, they're disposable. We use them once and we dispose of them. There's nothing on the needle. There's no medicine sprayed on it. There's nothing injected.
And they're teeny, teeny, tiny.
Yeah,
little
they're
things.
they're the thickness of your hair follicles. So when people say, "Well, what's it like?" and I go, "It's a tenth of the size of a hypodermic needle." So when you go in for an injection of some sort, those are 10 times thicker than an acupuncture needle. So very thin. But what that needle is doing is it's activating your nerve bundles, your neural nodes. We call them acupuncture points, and it's activating your blood vessels. And so those are what are being activated with the needle. The needle is really a vehicle to wake the pharmacy up, the pharmacy being the brain. So we use these in acupuncture points, and we have effects on different parts of the body based on where we put these acupuncture
And here's
needles.
something very interesting about where he puts them. Okay, so when I had this pain in this left shoulder, he never touched the left shoulder. There was never one time that he put a needle here. He could barely touch this at all because I would scream.
You jump off the table.
And he supported the arm with a pillow underneath it so that it was too hard for me just to hold it down in a normal position. It hurt so bad. So never put the needles in this side. And sometimes I have clients, they say, well, I don't know. I thought he was working on my right knee, but he never puts needles in my right knee. And I don't know exactly how to explain it. It's distal acupuncture or something like that. But do you want to explain that? Because that's really interesting that my shoulder healed and you put them on this side.
Right. So there's different styles of acupuncture. I practice what's called distal needling. So we don't usually put needles in the painful area. And the reason I don't do that is sometimes you create more pain first. And I don't like my clients leaving in more pain than when they came. So I avoid that, and I can get just as good or better results often by working on a different joint. So in Chinese medicine and acupuncture, we have mirror images. When you look at the human body and you look at an arm, the arm is really a mirror image of the leg, right? So you can use nerves and muscles in the wrist to treat the ankle, or the hands to treat the feet, or the elbows to treat the knee, or the hip to treat the shoulder, or the ankle to treat the shoulder. So there's lots of choices in acupuncture. We use different joints, sometimes on the same side of the body, sometimes the opposite side, because neurologically we're integrated. So when we use a mirror joint, let's say your left shoulder, we used your right ankle to start with, because neurologically those nerve impulses go to the brain, they cross over, and they start to affect other sides of the body. So we can use the left side of the body to treat the right side. We can use the lower body to treat the upper body. So if you run out of choices in acupuncture, it's your own fault as an acupuncturist, because you have lots of choices about how to solve that problem.
It's pretty cool thinking about how integrated our body is.
Yeah.
Like, and we live in a world of allopathic medicine where don't ask me about your eyes. You're here to get information about your heart.
Right. Everything's very specialized.
Everything's very specialized.
They're not talking.
But with acupuncture, it's literally treating the entire system.
That's the holistic nature of it. It's the whole body. So that's what's exciting about it is, if Michele has a shoulder problem, we can use her right ankle and we can see how she did. We can move to her left ankle. We can move to her right wrist, her left wrist, or her opposite shoulder. So there's lots of choices, and the best choice is the one that solves the problem. So.
Yeah. So is one of the perhaps objections that you get with acupuncture is the patient goes, oh man, is this going to hurt? I'm really afraid that it's going to hurt being stuck with a needle, because their only frame of reference is like going to the doctor and getting like a hypodermic needle. Right. Is that one of the concerns that people express to you?
Sometimes, yeah. Actually, it doesn't come up as often as you might think. Because most people are feeling worse, that they're willing to try anything sometimes. So it's like, couldn't be any worse than how I already feel, doc. Yeah. But yes, for some people it is a concern, and it's, it's valid. But these, so I usually say, well, you're only going to know if you try it, because you'll experience it and you'll know how it feels. It generally doesn't hurt. You feel things. You feel nerves being activated.
A little bit of tingling,
a heaviness, a fullness. You might feel a referral sensation. Sometimes we hit a nerve bundle and you'll feel it, temporarily. It'll shoot into the hand or the foot. But most of the time it's not, it's not painful. That's not the word I would use. It's just different. It's a different sensation that most people are used to. But once you get used to it, now there are things that can affect your experience of acupuncture. So some people who don't sleep well, they can be a little more, their nervous system is a little heightened. If you're under a lot of stress or you're in fight or flight, your nervous system is on edge. So you might be a little more sensitive if you're jumping at the top, the drop of a pin or something like that. But for most people, it's just a different feeling and sensation, and it's really about what the outcome is going to be. How am I going to feel after this? And that's usually what people want to focus on, because it's the effect of the treatment that you're after.
Yeah, and the cool thing is he has a very relaxing clinic where you can lay down on a very comfortable bed. He makes sure there's pillows in all the right places so you're comfortable, and so that you can actually get relaxed before the treatment, which is really important.
If may I share my acupuncture experience with you?
Sure.
Yeah.
So first of all, I want to say it was a very positive experience. There was no pain. It felt, I either couldn't feel anything, or I could feel the little tingling thing, and it was like, oh, this feels really good. Do another one. So I blew out lumbar number 4, and I had some sciatica in my left leg. I was my left side was pretty much paralyzed for a year. I was a mess.
Wow.
And we won't go into the details, but it was horrible. It was very painful. So I went to an acupuncture person, and she laid me on the table, and I had a little bit of fear and trepidation because it was something new. But I was like your thing. I'm in so much pain, I really don't care. But I couldn't feel anything. There was no pain. But what was interesting is that you just explained what this lady was doing to me. So she was poking the needles in certain areas in my back, my lower back, my butt, and down my left leg. But she also put them in the right side of my head. And I'm wondering, why are you putting me on the right side of my head? You just explained why, because there's pain receptors up there, and it's the opposite side of my left side.
Mm-hmm. Yeah,
That-
so, yep.
That was really strange.
Yeah.
Thank you for explaining that.
Yeah, absolutely.
I now know what the heck she was doing.
Yeah, yeah, and there's like a lot of different ways. Sometimes I will do some local acupuncture, particularly sometimes with back stuff. You got to loosen up muscle tissue. Sometimes it's better to do local stuff. But for the first few visits, usually people who are new to acupuncture, we just want you to stack treatments. There's momentum to the healing process, so that's why we do more than one. We do a package usually of treatments.
Do you find it's also beneficial to help nervous system and autoimmune conditions as well, Michele?
Yeah, I mean, he just alluded to how it helps the white blood cells, and so it is actually helping your immune system. And I wanted to actually ask you, there's certain things activated in autoimmune, and then you have to dampen the other side. And does it do that? Does it kind of modulate the immune system?
It modulates it, yeah. So it supports, geeking out here. TH1 and TH2, it's supporting the whole system generally. So it's supportive. And when we talk about the nervous system, like I said, it sort of activates it to relax it, if you will. So a lot of people after their treatment, maybe you had this experience, you feel a lot more relaxed mentally. You just feel like, whew, okay. I guess.
Yeah, kind of like you can finally take a nap if you need one.
Yeah.
Right, yeah, exactly.
Whereas before you're just wired and tired,
Yeah.
and that's someone who has a very activated nervous system that might feel wired and tired, and that can just kind of take that down a notch.
That's where the cortisol regulation comes
Yeah.
in. So
Yeah.
people, the night of their treatments, they do often sleep better, deeper, longer. So there's a lot of benefits to it. But I think most people still think of acupuncture mostly for pain, headaches, but it does so many other things.
Digestion.
Yeah, digestion, something else. And that comes back to blood flow also. So we work with a lot of folks that have digestive issues, and we use acupuncture to heal the body once we know what's going on. And that helps to bring blood and all the healing nutrients to the abdomen to heal the body. So.
Oh, speaking of nutrients, you talked about how the blood flow is part of all of this. So would it be safe to say, and I really don't know the answer to this, but would it be safe to say that in someone who has autoimmunity, it's helping pretty much every symptom they have? They may not even notice it for a while because it takes a while.
Yeah.
But is it also distributing more nutrition where it needs to go so that it can actually get to the cells that it needs to get to actually
it's
have
increasing.
an impact?
It's increasing blood flow.
Yeah.
So what's all the healing agents are.
Yeah,
in
and when
the
you
blood.
increase blood flow, you increase where the nutrition goes.
Exactly.
Yeah,
Yeah.
that makes sense. Okay,
For
I
sure.
thought so.
So what's interesting though is some people go, because they've had acupuncture with me for a while, and they come in and they forget how much pain they were in when they first came in, or they forget how they were feeling when they came in, and we'll do acupuncture over a few months, and then they'll kind of sometimes say, I'm not sure what the acupuncture is doing, and I'm like, you remember your back pain? And they're like, oh yeah.
And they're like,
Remember
oh,
how
I don't
you're
have
feeling?
that anymore.
Yeah.
Oh, yeah.
So sometimes we just have to remember where we were when we first started, and as we go through time, and we reduce treatments. So there's an intense, usually more treatments in the beginning to build momentum and get the results, and then there's maintenance care, there's continuing care. So that's more of a tune-up. I used to call it a California tune-up. I have folks come in once a month, just like you would get a massage once a month, just to activate your immune system and support it, and keep the healing vibes going. So at minimum once a month, people would benefit. But if you have something going on, then we usually want to see you more often.
I'll tell you, one of the things that helped me when I was going through my excruciating back pain is that the doctors loaded me up with all of these meds. I mean, most of them I can't pronounce, but in addition, there's Vicodin and Percocet and Flexeril and Synalgos and all these things. And while it helped with the pain, but I didn't want to take those things. And so I actually started to suffer some prescription drug withdrawal. It was bad. And I found that the acupuncture helped to mitigate the withdrawal system, and actually it alleviated the pain. And after a couple sessions, I was like, okay, I feel much better now. Thank you very much. Is that a normal effect? Of that? It really helped to get rid of that craving.
Yep, exactly. It helps. Because they're competing with the same receptor sites.
Yeah.
In the body. So I do want to make a distinction between acupuncture and what's called dry needling. For those people out there that have heard dry needling or had it, there are some important distinctions you just need to be aware of as a consumer. Dry needling is acupuncture by another name, usually performed by folks that aren't licensed acupuncturists, but they're, chiropractors or medical doctors or nurses. And they have a 250-hour training program they go through, which is mostly theoretical book work. I know this because I trained a chiropractor once upon a time, and I looked at the information that he was being taught, and I said, none of this has anything to do with clinical practice. It's all esoteric knowledge. It's nice, but it's not going to help you day one. But he passed the test, and with his license, he was then legally able to go stick needles in people, although he had never had any formal training. Wow. So I said, whoa, we're not doing that. I'm going to train you how to do acupuncture so you don't hurt people, because there is a risk of hurting people when you don't know what you're doing. And what I found is in the dry needling world, and it's not to say they don't do a good job, but dry needling is usually focused on a specific joint, and they're trying to release trigger points. Trigger points are areas where a lot of nerves and muscles intersect with each other, so they tend to be pretty powerful points, and they release muscle tissue and endorphins. And so they're trained to kind of go into those specific areas, but they don't have a training in terms of theory of acupuncture. They have very limited education, and they're focused on a joint. So you just have to have some caution if you're going outside of the acupuncture. You want to look for a nationally licensed acupuncturist. So we have a national board certification, and then some states have their own certification, like California and Florida, and I think New Jersey. They have their own testing set up, but most people in the country practice under a national license. So you want to look for someone who's nationally board certified, a licensed acupuncturist. They usually have about 4,000 hours of training in addition to herbal training and things like that. So there's a huge discrepancy out there between what we call dry needling and acupuncture. And I just caution people to know what they're doing and who they're working with, because acupuncture is understanding the theory behind it and what you're trying to achieve. It's more than just putting needles in a particular area. So just as a consumer, people need to be aware of that.
Great information. So, Dr. Lane, if someone has questions about acupuncture, how can they get a hold of you?
Oh, well, they can look us up online. Our website and links should be below this, but it's elementalnaturalmedicine.com for those folks that are local. That's a good starting point. You can find us online. You can give us a call. Our numbers should be listed right below. And we do offer a complimentary 30-minute consultation. So That's a good starting point to go at.
Michele, how can we get a hold of you?
KMichelleSchroeder.com, and it's with one L on Michele.
Very good. All right. I want to make sure they know that. Hey, I want to thank you guys for joining us with another exciting episode of Wellness Warriors. I understand our next episode, we're going to be talking about hidden lifestyle factors that can make or break your healing. Yeah. So you guys be sure and check that out. We'll see you again next time. Thanks.
Mm-hmm. Thanks, Michael.
Thank you.
Take care. Bye-bye.
This has been Wellness Warriors, giving people the knowledge to have a healthy and vibrant life. For more information, elementalnaturalmedicine.com and KMichelleSchroeder.com. We invite you to join us next time for another edition of Wellness Warriors.
Claire.
Are we clear?
That was good.
I had a